Hi, and welcome to SPE Live. I'm Michael Gaines, host of the podcast NOV Today, and we want to welcome you to this first live event that we're doing here at SPE International. Today, SPE is going to be bringing you a conversation about HSE, or Health, Safety, and Environment, and COVID-19. We're actually testing out some new live features here today, so if we have any hiccups, we ask that you bear with us as we try to get this going, but we're looking for a clean broadcast today. So we have a lot to discuss today on the pandemic and everything affecting the upstream oil and gas sector. In today's program, we are going to have a panel of experts who are going to be standing by with their perspectives and insights into the global crisis, as well as SPE HSE Technical Director Johana Dunlop, who will moderate that particular session. We'll also be joined by the 2020 SPE President, Johana Dunlop, and hear her inspirational message to the oil and gas community. A little bit later on, we'll continue our conversation as we get more audience interaction. So we're going to have David Gibson and a guest who will include Flipping the Barrel team, and they'll be discussing things like coping with working from home, as well as sharing tips on how to market yourself during the time of layoffs, furloughs, and social distancing. So that'll definitely be a good conversation there. So a little bit more background on some of the topics that we're going to be covering today around COVID-19 and the impact to the industry. With companies reducing costs around the globe, it's caused very much a significant market reaction. And due to the pandemic, Rystad Energy actually projects needing 6 to 22 months to recover and then expects demand to return. As for jobs, Rystad estimates more than 1 million oil service employees will either lose or have lost their jobs during this particular crisis. So that means that sums up to around a 20% reduction compared to the 30% cut after the 2014 crash. So we'll be getting to these topics and a little bit more in the panel later in our program. For those that are working from home or looking for tips on protective measures against the coronavirus, the World Health Organization provides some basic points that we wanted to share with you. So again, as a reminder, and I think it's good for all of us to have these reminders, we want to wash our hands frequently with soap and water for at least 20 seconds, want to maintain social distancing from others, and of course, maintain at least a minimum of 3 feet from others. Avoid touching your eyes, nose, and mouth, and greet safely with a wave, a nod, or a bow. The globe is really battling COVID-19 and is changing the way many of us operate in both work and social circles. So the worldwide case is nearing the 1.3 million mark. And what that means is, unfortunately, that means that it's claimed the lives of more than 70,000 people. And the upside is that the number of recovered patients is increasing and now is north of 270,000. So coming up in just a couple of minutes, we're going to have our first panel, which will discuss the frontline support to the oil and gas industry. Also, companies will talk about how they're coping with the impact that it's had on organizations with respect to commodity prices and the pandemic. Again, later on in our program, we're going to hear from our 2020 SPE President, Johana Dunlop, as she provides a message for all of us that will hopefully inspire and uplift us during this time. As we move into the panel with David Gibson, we'll be having a Q&A segment with he and his guests, and they'll cover several items that I think will be very interesting and insightful for those that are watching. So also, we'll talk about what you can do if you've recently either been laid off or if you are just about to graduate from college or are looking to move into the industry. So we encourage you, as we go through this conversation today, to take part and interact with us. We will be moderating comments and answer your questions as we go along. At the conclusion of the broadcast, the conclusion of this broadcast, this video will remain on SPE's social channels, where you're welcome to share with your networks or anyone else that was unable to take part in the live broadcast. So we're glad you're here, and we look forward to jumping into our conversation today. Thanks for joining us.
Thank you, Michael, for that really great introduction, and thank you especially for including a safety moment. As you know, many of our meetings in the industry start with a safety moment, and that was really good advice, serious advice for all of us to share. This is the first. It's the first SPE live cast, and I'm proud that the health, safety, environment, and sustainability discipline is the first discipline that's participating in this new approach to engaging with our members and engaging beyond the SPE. We've got 7 technical disciplines in the SPE, and I think we're the only professional association that welcomes health, safety, environment, and sustainability professionals along with drilling completions and more core technical disciplines. And we've got some of the finest HSES professionals in the industry are members of the SPE. And it's a comfort to me to know that many of you are listening in, and really delighted to be with you here today. It's exciting because it's a first live cast. At the same time, it's extremely sober. We're in the middle of a huge crisis. We've been in crisis mode in the industry since the middle of January because of the international nature of the industry. Sometimes we're ahead of the curve, and we were ahead of the curve in many, many countries. And our speakers today are going to share some insight to what their companies have been doing to manage this crisis, protect their people, and also to protect their operations. So welcome, everybody. We're in for about 40 minutes of listening to our wonderful panelists and having some Q&A. So don't forget to send in your questions. We look forward to lots of interaction with you. So I'd like to introduce you to your 4 panelists today. We start with Francesca Viviani, who's the Director of Public Health for International SOS. Francesca is also serving on the IOGP and IPICA Joint Health Committee. Always delighted to have you, Francesca, with us at SPE. We always enjoy your presentations. Francesca has been working in crisis management for over 15 years and is directing the public health programming for International SOS, interfacing with our industry, supporting the oil and gas industry, but also many other industries. She's also worked with NGOs and UN agencies, so incredible perspectives that she's able to bring to us. After Francesca, we're going to hear from Dr. Frederick Jervell from Equinor. Hi, Frederick, good to see you. Frederick's a specialist in occupational medicine. He's the leading advisor for medical services, also on the Joint Health Committee of IOGP and IPICA, and has been on the front line basically since the middle of January, managing the COVID crisis for Equinor and also supporting the industry through the Joint Health Committee. We're then going to hear from Mark Scanlon, who is leading the HSE practice. Hi, Mark, at the Energy Institute, working collaboratively with a lot of international stakeholders, leading up team project managers, supporting our industry, but also supporting renewables and hydrogen, carbon capture. Well, so quite a range of perspectives there. Looking forward to hearing from you, Mark, and the work that you've been doing under very stressful circumstances on creating COVID-specific bow ties. And then hear from Riam Johnson. Riam is hi Riam, good to see you. Riam is the Chief HSE Officer for NOV, a service company. She started at their Next Generation program and very quickly established herself, moved over into corporate engineering and worked on their Tier 4 emissions management program, and started creating NOV Ventures. She moved over to R&D, built the flagship technical center, was then named as VP of R&D Technical Center for NOV. And then in 2019 came into her HSE role. And it's always wonderful to have people come into these roles who come from operations and R&D backgrounds, because you bring in fresh eyes to us, you know, the geeks of the HSE function, and it's great to have that mix of perspectives. And I know already in your 6 months you've made your mark and are very supportive of the function. So with no further ado, I'd like to pass the camera and the mic over to Francesca. Over to you.
Thanks, Johana, and thanks SPE for organizing this live event, and welcome to you all. I think Johana say is a first for everybody. It's a first for me also to do something like this. I would like to start providing just some general context for all of us on what we are talking about. As you know, towards the end of December 2019, authorities in Wuhan, in Hubei province, announced a cluster of cases of pneumonia associated with a wholesale market. The virus was subsequently identified as a new virus, never circulated in human people before, and the virus was called SARS-CoV-2. The disease associated with this virus is called COVID-19. On the 30th of January 2020, the WHO declared the spread and the outbreak of COVID-19 a public health emergency of international concern. This is a part of international regulations for improving health of everybody. At the time of the declaration, there were less than 8,000 cases confirmed worldwide and 19 countries. As Michael was reminding us at the beginning, we are now around almost 1,400,000, and 184 countries are affected. This in less than 4 months. What did the oil and gas sector did? Well, the oil and gas sector, as Johana was mentioning, reacted extremely promptly. They started to organize themselves even before the public health emergency was declared. And for international assessment, we entered immediately, we activated our business continuity plan. So why the sector reacted so promptly and differently from others? Well, I think that the main priority for the sector is and will remain the health and safety and well-being of employees, their families, as well as the community where the sector operates. This is really important because this has created some structure and places that the sector can use. Firstly, the sector has measures in place for the control of infectious disease transmission, especially inside the fence, being this platform or onshore location. What happened with the COVID-19 was that these measures were constantly updated by the company to reflect the daily knowledge we gain on this COVID-19. And I know that Frederick will give us a fantastic example on the importance of this aspect. Secondly, another specialty was the fact that we learned during the Ebola outbreak in 2014-2015 how a health event that is not promptly managed can become a crisis of a much bigger scale. At the time of the Ebola outbreak, I was doing some research about outbreak preparation and collaboration between multiple stakeholders. And what we identified was that a key component of the business continuity response was collaboration and partnership. Companies might have collaborated with different stakeholders and with different groups. And we found out that the same strategy happened with the COVID-19. All the companies activated the crisis management arm immediately. They transferred lessons learned from certain countries that were affected at the beginning, especially China. They shared PPE where they were needed, not they were stocked. So when they were needed in China, these were moved, and then they moved to Europe and now eventually to the States. And finally, they share best practice among all the operators. The Health Committee of IOGP PIECA convened for the first time already in January, and we started to share experience among not only the companies, but the whole sector. This is important, this is essential, and gave a very good way for the sector to respond to this. especially if we consider that on 11th of March 2020, WHO considered the spread of COVID-19 a pandemic. Nothing happened or changed with the virus. What happened was that suddenly everybody and every country was affected. I suppose all of you have become now very familiar with the epidemiological curves that describe the spread of the virus, as well as how different measures can impact and alter this type of shape. Well, these are the same curves, together with scenarios, that the company use for making decisions as part of their business continuity plan. During the initial growth of the transmission, when the cases were still fewer, company put in place different control measures or prevention barriers. And these were about reducing the risk of infection in the workplace. During the rapid growth phase, when the things started to go very wrong, because of the lockdown, or because of a very precautionary approach, company decided to have a work from home policy, and they started to support with a wellness program and well-being and psychosocial support and stress. Let's remind that also most companies remained operational and are still operational, so we still have people working on oil field. In this case, the measures became much stricter. What we are seeing now, either in countries that are on the declining phase or countries that are preparing for a return to a new normal, the priority and the measures are changing. Companies put in place the same measures that they had at the beginning when the growth of the epidemic, as well as new things that we are developing as we go along. There is an increasing talk of masks, or rapid testing, all things that are coming out now that may not have been available in the past. What is important is that we know that nothing functions in isolations and there is no silver bullet. So collaboration and discussion and events like this are fundamental for the sector to move on. And these were my initial remarks. Thanks.
Thank you very much, Francesca, and reminding us also that most companies are still operational. And that we're learning every day. So there is this new normal and new measures coming in, but there's no silver bullet. So let's pass over now to Frederick and hear how Equinor is managing the COVID crisis. Frederick, welcome. Thank you for being with us today.
Yes, and thank you, and thank Michael for having the SPE arrange this. It's very interesting to participate. Francesca mentioned collaboration, and I'd just like to start off by saying that we have a long-standing relationship with ISOS and terrific collaboration with ISOS, especially for this event. I wouldn't call it an incident. It's too big a scale. Great support from ISOS, and we've also really appreciated our collaboration and support from our peers. Sharing is very important here, and we are trying to share what we can and receiving great support from our colleagues in the other oil and gas operators. Jason, could you show my screen, please? I'm going to talk a little bit about how Equinor has approached COVID in an offshore setting. We've managed so far to keep all our installations operational. It's been challenging, and we have learned a lot. For those of you who don't know Equinor, we are a Norwegian oil and gas company with a global presence in all regions of the world. We operate mainly on the Norwegian continental shelf, but also in the UK sector in Europe, in the Gulf of Mexico and Brazil. And we have exploration activities in many other locations. Let's see. There we go. Just to start off, COVID-19 is, for us doctors, it's novel, yes, but it's not new, it's not unknown. Managing infectious disease offshore is something we've been doing for 40 years. We have a lot of experience in keeping our people healthy and safe offshore. And for COVID-19, we use the same principles as we have for all other infectious diseases. We prevent the infection from coming offshore. When it does, we contain it and medevac our afflicted staff safely. A few important principles that we have used for this one is we've developed a bow tie model for the organization. We're working very hard on social distancing. I'll get into that later. We are also quite strict on testing. We test a lot. And we quarantine and sanitize. when we have a case. I'm going to start by showing a case study from 2018, and this wasn't COVID. This was a virus called Sapo Virus, which is a relative of norovirus. It causes gastroenteritis, mainly diarrhea. And this happened on one of our larger installations during turnaround. We had 462 people offshore at the time. The index event was a person vomiting and then failing to self-quarantine in the public toilets at May 12th. And then 4 days later, we had 15 cases of people puking and having diarrhea in their cabins. So this was quickly identified as an outbreak, and containment measures were introduced. Basically, isolate, start cleaning. And we have a whole set of procedures that we use for common areas. Everything was shut down, and cleaning frequency increased. So we started testing for the virus. The normal test procedure in Norway goes only for norovirus, so we missed the diagnosis. We didn't identify the agent until May 20, when we had a new resurgence of the outbreak, up to 17 cases in one day. Then we identified it was Sapo virus, and that knowledge is really important because it tells you that for Sapo virus, you actually need to isolate them for 48 hours instead of just 24 with norovirus. And the incubation time is longer as well. So we use that knowledge to strengthen our quarantine and containment measures and managed to break the outbreak over the next week. The main factor actually in this outbreak was an underreporting of symptoms. This was during turnaround where you have a lot of people, contractors and subcontractors offshore, who will lose their income if they don't show up to work. And they didn't report symptoms and they failed to self-isolate. And that led to a delay in or prolongation of turnaround by 3 days, which was a considerable impact for us. So by June 8th, we were quite sure that this outbreak was over and we ended our containment measures. So the simple measures that we used here, we also use for COVID. Johana asked me, how does one operate offshore in the time of COVID? Well, the answer is at a distance. We practice strict social distancing. Basically, all the measures that we introduced for managing Sapo virus, we are now constantly, they are active on all our installations. Gyms and common rooms are all closed. People basically work, eat, and go to their cabins. We have staggered meal times to increase distance, as you can see in this picture. We don't have any buffets. All meals are served or plastic wrapped. All meetings are conducted with social distancing or by video. We disinfect everything several times per day. And people are very well aware that if they have symptoms, they self-isolate and then call the medic instead of showing up. We have reduced our manning to operational levels. We have delayed a lot of non-critical maintenance. And the helicopter companies with whom we collaborate quite well or excellently have reduced their flights to 12 passengers from the normal 18, just to be able to maintain distancing in the helicopter as well. This is all to reduce the number of close contacts if there is a case, and also reduce the possibilities of transmission. So if we have a case offshore, we divide it into high probability, medium probability, or low probability. For the high probability, we isolate, we test, we quarantine all close contacts. For the medium probabilities, we isolate and test, but we ask the close contacts to self-monitor. And for the low probabilities, the common colds, simple allergies, that we isolate them until they're well plus 1 day. We don't test them, but we do contact tracing in case the situation develops. So far on the Norwegian continental shelf, we have tested 19 people. It was, I forgot to update this slide. We have had only 1 case positive. And the prevalence in Norway, fortunately, is quite low. Testing is important because it ensures that we can identify a case and medevac only the case that we need to medevac. It also prevents disruption to our operations. Having 20 people in quarantine is difficult, and it reduces fear. Fear is really important here because your employees need to feel safe when they're offshore. They can't have their focus on being afraid of a disease. They need to focus on their safety critical work. So being able to test people offshore and in 18 out of 19 cases stand down is incredibly important to maintain operations for us. I'm going to, and I'm sorry for the busy slide, I'm going to quickly delve into the one case we have had at the Martin Linge installation. This was March 9th. We had an Equinor employee who came offshore at March 4th after returning from Austria. We added Austria to our high-risk list on March 9th, where the person reported to the medic with symptoms, was isolated in cabin, and we did contact tracing, found 35 close contacts, including most of the management team. This was challenging. POB at the time was 776, including 2 flotels, because it was a coal platform undergoing construction. So we tested the individual. We flew the test to a hospital by SAR helicopter. It took 2 days to get the results, which was positive. So then we medevaced the index case and 1 more contact. For the whole duration of this, our incident management team was mobilized, and things were still quite in flux. This was when it was quite new. So we decided to demobilize everyone not quarantined, non-essential staff. That was 650 people. We also returned the flotel onshore. We did further testing of 6 close contacts with symptoms, who developed symptoms. They turned out to be negative. So now the entire installation has been sanitized. The flotel has been sanitized, and 2 weeks after the evacuation, we've started remobilizing. Principles are the same: isolate, quarantine close contacts, maintain safety. This is crucial. Then demobilize your non-essentials and regain control to remobilize. It's a good way to manage fear. It's a good way to manage operations. I'll quickly go into this bow tie model we created as well. On the left side, you can see your likelihood reducing measures. On the right-hand side, you can see your consequence reducing measures, where the index event is 1 person infected at an offshore installation. So first, you need your public medical infrastructure and your local government to reduce the likelihood or the prevalence of disease in your population. You need to have a sick leave policy so that people who are sick don't actually show up to work. Travel restrictions to reduce the likelihood of some of your employees becoming sick or infected. Employees need to be aware. You need to have a travel contact quarantine policy so that people don't go to work. And access control is a final barrier, but it's not a very good one. It's hard to screen for infection. To prevent further cases, you have your social distancing and sanitation measures. You have your identification and quarantining of close contacts. And to reduce disturbance of operations, we rely on employee confidence. It's really important to us that our people are safe and feel safe. So we collaborate with the authorities to have people tested, to have the resources we need. And we have a robust company, so we haven't had large disruptions to our operations yet, thankfully. Subject to change. Thank you, Johana. I will leave over to the next speaker now.
Great. It's really, really interesting and very impressive to see the level of mobilization and the depth of knowledge that you're deploying. Really liked your mention of collaboration and sharing. It's something the industry is good at, and really liked some of the transparency in showing where things hadn't worked out in the past, and that you're willing to share that. I think that's really, really, really important. That's how we learn. Liked your shift of vocabulary, not using the word incident, but event, and novel but not unknown. It's true, the industry's been managing infectious diseases for over 40 years and has incredible knowledge through medical officers like yourself. Really interesting to see your point about underreporting of symptoms, and think this is something we really need to keep well within our sights. It's good to see companies, so many companies, being really proactive in how they're going to protect their employees. At the same time, we're in the middle of an oil price crisis as well, so there are a lot of incentives, I think, for underreporting. It's also interesting from a mental health point of view, the kind of stresses that people are putting themselves under. So one I think to watch really, really carefully. And your message about confidence and reducing fear, I think is a really important one. Just before we hand over to Mark, I'd like to take a question from the audience for you, which is, how do you, so you said test, you're doing a lot of testing. So a member of the audience wants to know how you acquired test kits.
Collaboration with the authorities and local laboratories at the hospitals we usually send our patients to. And they've been very gracious with us. Norwegian testing criteria they don't normally include our population.
Yes.
But the consequence of a confirmed case offshore, we managed to communicate with the hospitals and have achieved testing capability to a certain extent. Not necessarily as many as we would like, but testing is short to come by at the moment.
Yeah, no, it's a major issue, and there's some divergence as well amongst the scientists as to the role that testing can play. So let me hand over to Mark, who's got a question for you, and then Mark, I'll let you move straight into your presentation, if that's okay with you.
Yeah, thanks. No, that's fine. Thanks very much, Frederick. So my question was about repatriation of people where you'd consider medivac, and say, for example, you're operating a facility in the Norwegian sector, but an infected worker was not from Norway, i.e., that, for example, they're a contractor worker, and you contemplate medivac. Would they be medevaced back to Norway or their country of origin? For example, if it's from elsewhere in the North Sea.
We've actually had that issue come up, not for infected, but for suspected contacts. It's a challenging issue that you kind of have to manage on case-by-case basis, depending on where that person is to be repatriated. My medical instinct, if they are close contacts, is to quarantine them in a hotel on arrival to shore. So you can be sure of the quality of the medical services and take good care of your employees. But this is done case by case, really. Hard to find the proper guiding principle other than safety.
Very, very good. Thank you very much, Frederick. So, Mark,
have repatriated individuals.
Oh, over to you, Mark. If you'd like to start the presentation.
Yeah, no problem. Right, let's fire away. I just have to fire up my screen. Just hold on for a second. Yep. Okay, so hopefully that is visible on screen now. And excuse me, just hold on. Yep. Sorry, too many screens there. So I'll be talking about a COVID-19 bow tie. And this is a bow tie that visualizes your role in the pandemic. So we just heard the word collaboration several times, and whilst I'm presenting this today, this is really on behalf of a group of individuals who, over the last couple of weeks, have developed this bow tie and a supporting document. And those individuals are listed there. So the ABS group, Martin Johns at EP, Roy Miles of HUTEC, and Charles Cowley of the Centre for Chemical Process Safety. And those individuals are really bow tie specialists rather than medics. So what you'll find in the next set of slides is an overview of what that bow tie contains, also how it was developed, and also a bit of the reason why it was developed as well. So moving on to the next slide. So those that don't know, there is actually an industry resource that covers bow ties in risk management. So that was published a couple of years ago by the Centre for Chemical Process Safety and the Energy Institute, published in September 2018. It was all VGL, and also with the support of CGE Risk as well. But that work was done collaboratively under the direction of around 20 risk specialists from those in the USA through to Europe, as far away as India as well. The particular benefit of this piece of work is that it is an industry good practice consensus guide. It clarifies bow tie terminology, gives you guidance on how to lay them out, illustrates practical uses, covers lots of do's and don'ts, hints, tips. It also introduces the concept of multiple and also human factors or behavior bow ties. And in a way, why that was developed was to try and consolidate industry knowledge, which hitherto had probably been associated with particular software products and particular organizations that had expertise in developing bow ties. And of course, some companies had used them extensively in their risk management processes. So as well as the core team of 20 people, there was also around 30 proactive stakeholders that did in that work. This presentation, I'll keep referring to that graphic on the right-hand side, which is the place where you can freely access the bow tie developed by that group that was listed on the first slide. So there's a web address in the bottom right-hand corner, and on that web address, which is a bit like EI's page, the Energy Institute's page for its members about COVID-19, there is actually a link to a technical resource. So you have to read a blog, and then at the end of that, there is a link to the technical resource. So that web address will appear on other pages as well. So the reason why we generated this bow tie was that there were some bow ties in circulate that weren't aligned to the CCPS and EI guidance. So maybe some of the threats are in the wrong place, or some gave a false sense of security as they contained too many barriers in inverted commas, but some of those weren't really barriers because they don't stop an accident trajectory. So commonly and hitherto, bow ties have been associated with representing prevention mitigation measures, in particular for major accidents, but they could also do things like work at height on the safety side. And there's a lot of experience in laying out those bow ties, but the guide promotes consistency. But probably until recently, there hasn't been a bow ties for things like COVID-19. So a subset of the members of that CCPS/EI project team agreed to develop a consensus bow tie. So a group decision on what that bow tie should contain, decision on how it should be laid out, and also the center bit about what the hazard and the top event are using bow tie terminology, and also what the threats are and the consequences. Okay. So there's the web address again, and there is also a link to that site from CCPS as well, from their own website. So moving on to the principles embodied in this bow tie. So the first thing is, rather oddly, there's no new advice. So what I mean by that is there's no new medical advice. Anything that's listed on the bow tie has come from either the UK government or the Centre for Disease Control. Now, if you say, well, I'm not in USA or UK, what you should do is in the context of your own government and health institutions. So think about what they're saying and whether it aligns to this bow tie. If something is different, then the reality is you need to apply your local requirements. So the odd thing in this bow tie is that the top event in the center of that diagram, that red blob, focuses on an individual. So whether it's someone at work or someone at home or someone who might ordinarily go to work who's currently at home, or a bit like Frederick says, someone on an offshore installation, it focuses on the individual. And the top event is that individual being infected by the virus. So the common thing with bow ties and how they're laid out is on the left-hand side, you identify threats, and on the right-hand side, you identify consequences. And on those threat lines or consequence lines, you'll see this will be expanded into further detail in the subsequent slide. So where you see plus or minus, there's a way of expanding the level of detail there. But the key thing to note on that summary is that there are only 2 threat lines on the left-hand side and 3 consequences identified on the right-hand side, one of which is the death of the individual. That's the ultimate consequence of someone being infected. And the alternative is death of people that you transfer the virus to. Or there's another effect which kind of links to mental health about the effects of protracted lockdown. So we'll look at some of those elements in a bit more detail. One of the points to keep making, that I need to keep making, is look at that website, because you can access the document freely that contains far more information and explains more about how the document and the bow tie itself have been constructed. So looking at prevention barriers, so they're located on the left-hand side. So they stop the 2 threats that are listed leading to the top event. That's the person being infected by the virus. But as you'll see with this, there's actually only 2 threats, and one is about airborne transfer of the virus, and the other one's about contact with infected surfaces. And you'll see that the barriers, each barrier tries to stop the progress of that threat leading to the top event. Normally, we call that an accident trajectory. All right? And where you see those plus signs, there's additional detail that underpins those barriers, the strength of those barriers or challenges to those barriers. And we'll look at some more about that in a moment on a subsequent slide. So the left-hand side about preventing the progress of the virus and picking on one of those barriers in particular, which is highlighted there, and just expanding it out a little bit. So the barrier is about self-isolation. I stay at home and avoid all contacts and gatherings. And if you look at the additional detail here, what you'll find is there's 2 degradation factors and 2 pathways with controls on them. They're not called barriers because they can't stop the progress of the threats to the central to the top event. Hold on. And here there are only controls listed. Sorry, excuse me, my screens are doing something. So moving on to the right-hand side of the bow tie, the barriers here stop the individual either leading to their own death, the death of other people infected by that individual, so they're the consequences on the right-hand side, or to find or the other consequence listed is a protracted lockdown. Note here again, you can break this out into further additional detail in barrier degradation pathways, and these aren't shown for the right-hand side. So on to the last slide here. That's actually a miniature view of what the whole bow tie looks like. Clearly, you need to look at the source document to actually look at that in detail and study it for yourself and zoom in on all the different areas, looking at the threats, the degradation factors and the controls ultimately leading to the consequences. So what stops the threat ultimately leading to the top event, and then onto those particular consequences listed. So a version of the bow tie was published on the 31st of March, and currently some industry feedback is being rationalized with the intent to issue a new version of that bow tie responding to that feedback in the next few days. So the working group has actually discussed that bow tie and some of that feedback with a view to updating the bow tie and the document that surrounds the bow tie as well, which is available from EI or CCPS. So we do intend to revise the bow tie again if there's any further feedback, maybe not every week, but less frequently than that. And we're also thinking about whether there's benefit in developing an exemplar bow tie for an offshore installation manager, or maybe one a bit like Frederick showed, but probably using this type of structure for an organization. So one other point of credit, as well as the people listed here on the last slide, just to note that the bow ties in the document were developed using ABS's thesis software. Other software can actually be used to develop that bow ties as well. So the final thing from me is again about collaboration, just to say thanks to the contributors, Mark Manton, Martin Johnson, Rob Miles and Charles Cowley. Thank you very much.
Thank you very much, Mark, and a really interesting presentation. I guess a sign of our times, we're all working from home, so I know there was a bit of a lag there with the internet, but I think the slides helped a lot. So thank you very much, Mark, and really congratulations to the Energy Institute and CCPS, you know, for responding so quickly to this specific need in the industry. It means we don't all have to go around reinventing the wheel and creating our own bow ties all over the world. And quite a few of the audience were asking, can they have copies, you know, of your bow ties? So I hope everybody captured the link. If not, it will be shared with you, and we'll make sure that there's an easy way for you to get access to the bow tie. And as Mark said, it'll evolve very, very regularly. I'm just going to capture a couple of questions, you know, hot off the feed before we go to our last speaker, Riam Johnson. One is about the protocol for land seismic operations during this period. Francesca, could I ask you to answer that question?
Yes, thanks, Johana. And thanks for the presenters to bring these points. What we mentioned is that we know that the risk of transmission is absolutely clear that people need to be working far from each other. Social distancing is still the main measures we have in the absence of pharmaceutical intervention. So what we absolutely recommended is the same recommendations that there are, for example, on the offshore, is to ensure that people are at least 3 feet or a meter from each other. If anything is below this distance, then personal protective equipment need to be worn. Again, companies adopted different types of measures to reduce the risk of transmission, and I think Frederick made quite clear the fact that you know, communal spaces are not used, that you know, there is no buffet available. So every locations in which staff is close to each other need to be considered. Of course, offshore locations are more at risk because of the need to transport the patient from an oil rig to an hospital. But any location where the staff can get in contact with each other or can get close to someone else need to be considered, and barriers need to be put in place. So education to staff about measures is essential. Active screening about symptoms or any other or fever, and then workplace policies about distancing. And if distance cannot be ensured, then personal protective equipment.
Thank you, Francesca. We'll go now to our last speaker, to Riam Johnson, who's the Chief HSE Officer for NOV. Over to you, Riam.
All the speakers that went ahead of me. I'm batting cleanup here and going last. So many of the guidelines or preventative measures that I would have stated already have been stated at this point. So good teamwork there and collaboration. I want to further drive the point home that it is important to recognize that these are difficult times. It's really refreshing to hear the speakers talking about collaboration so much, because it is important that we all pull together to make it through. That is not just, I mean, that's something that we're preaching at NOV among all of our different, you know, business units and business segments, which I'm sure there's a lot of large companies or members of large companies listening to this struggling with kind of the same thing. But it's really quite nice to see people pulling together on this, because we all are affected by it, not just us as employees or people of part of the industry, but really our families and our communities, like one of the earlier speakers had said. We are also, what we have in common, obviously, with this industry, we're all fighting the same two-front war, right? With the struggling oil prices and balancing and keeping our folks happy, or not happy, excuse me, healthy, hopefully happy. But what that further says is that we're an essential industry. We perform a very important work. So it's important to make sure that the workforce has what they need in order to be productive and safe. Frederick, you really hit the nail on the head there about making sure that we're alleviating what we can of fears so that people can focus on the tasks they already do day to day that are risky, right? And making sure that they're focused on their message and on their work. It's great to see the whole industry come together on this. So just a few things on what NOV is doing. So us as a service and equipment manufacturer. So we're looking out for people, similarly to Frederick saying that you're looking out for people, out on the rigs. We have shops and warehouses, so we have employees that are there. Obviously, we have people in offices as well, and we also send some of our people out to customer sites to service the customers. Strategizing is a very big thing. One of the things that we're doing, obviously, so I've heard it from multiple other people talking about implementing and standing up these regional crisis teams. So we've, done that across the board. We make sure we have, the right people on there from HSE and HR, security, and folks throughout the operation, so that all voices are heard and strategized together there, especially on a regional level where I think somebody said earlier, things are changing day to day. Having a legal representative on each of those teams as well is very effective, staying on top of, keeping us all out of trouble essentially, but making sure that we can still move forward and go on, and tracking trends as well, and seeing some of what I think, Francesca, you were saying about like the trending of the cases that are going up. Same thing with you, Frederick, in your case study of seeing okay, what was the date of when these cases happened? What measures are we putting in place? Seeing how well these are being adopted and how effective they are. So we're doing the same thing at NOV as well, and in doing so, we're aligning our efforts, across sites, across employees that are still traveling because they need to be able to support, customers. The rigs are still operating, and we're also staying on top of customer requirements. So as customers are, protecting their sites, obviously we're protecting ours as well, as far as having visitors on site, making sure we're screening people properly, and understanding what their what their travel history is, what could they have been exposed, and that kind of thing, and making sure we have barriers are in place to where we're not allowing that inside. One of the biggest things we're doing across NOV is a huge stance on communicating across the board. We created an internal coronavirus website. It's chock full of so much information, from posters and memos and flyers, because another thing we're doing is sending out emails globally as far as on a regional level. But as we all know, that only reaches people who have email, who have computer access. So it's really a huge movement for all of us that have access to that, to make sure that same message is reached to the shop floor as well. So again, we have all this printable information. That's what we utilize in toolbox talks. Those toolbox talks are different now. They're not a big room now. They're kind of in smaller groups, so that the message is still shared and is still received, but in a safe manner. So that kind of segues into, again, same thing you were saying, Frederick, about minimizing the number of people in the same place at the same time. So implementing work from home measures. I don't know about other folks out there, but I've actually found myself to be a lot more productive working from home and keeping in contact with people, using technology to connect. We've staggered and we've implemented staggered and rotational work shifts in the shops, staggered breaks and lunches, mandatory hand washing breaks. We've limited travel to just absolutely required for customer needs. The thing that Frederick, I really took away from your measures of your case study was I noticed that there were multiple days that went by with no cases before you even started returning back to normal. So that's a message that we're delivering as well at NOV, is continue these measures, even if you were seeing, you know, in whatever country or region that you're in, even if you're seeing these improvements, we can't let off the gas pedal. We got to keep going and implementing these same measures. But otherwise, we're making sure we send positive messaging out to people, really, you know, praising them for the good work that they're doing. To implement social distancing. You know, the no handshakes, kind of a wave thing that Michael Gaines was talking about, and my husband says high five wireless. So that's kind of, you know, greeting each other in a kind of a playful way. There you go. And so very good. And then frequent and thorough hand washes as well. But anyway, so those are kind of general measures that I think a lot of people are taking across the board. Just the same message of like working together, I think is a huge thing that we're driving across the board. We actually had some of our positive messaging. This video cast, Michael Gaines is our guy in NOV. And so we've done some video podcasts as well with Clay, our CEO, making sure that the workforce hears from leadership, right? And that we're all in this together. We just recently did a panel discussion on our leadership team between our Chief Administrative Officer, Bonnie, and then our Chief Information Officer, Alex, and myself, just to make sure we're addressing folks as well. And they can hear from us, they hear our tone, they hear that we're all in it together. I think it's a very important message to drive, and it's great to see the whole industry pull together to drive that same message.
That's great. Thank you so much, Rio. A really, really strong collaboration and communication message there. So we've got all our speakers up online now, and getting quite a lot of interest in the questions about the bow tie method that you've all referred to in different ways, and the idea, we've been talking about collaboration and sharing amongst ourselves, but thoughts coming in about using the bow ties to collaborate externally and to share externally. So, you know, the kind of potential for the bow tie to be used by the public, to be able to risk assess their own situation. I wonder who'd like to take that question and have a go at it? Francesca or maybe Frederick? Do you want to? Maybe Mark. You're the bow tie expert.
I don't mind.
Your internet's a little bit choppy, unfortunately. Let's see if we can hear you properly.
The view of our working group is that it'd be very desirable if the public, or really actually governments, promoted the use of a bow tie as a visual aid to help people understand what are the real barriers, what are the kind of like things that challenge the barriers, and how all of that stuff fits together. So if governments or the World Health Organization would like to adopt the bow tie methodology and use that example, we'd be delighted.
Great. And Francesca, you've got an arm and a leg and in all sorts of different pots and different sectors. What do you think the potential is there for the bow tie to have more broader uptake?
Absolutely. I think it's a great initiative. We have actually, I got the bow tie that Mark was presenting, the day that was published from one of my colleagues. Actually, we got it from one of my clients. So I think it's already circulating out there. And we know that the oil and gas sector is at the forefront on a lot of health and safety process and procedures. So for me, there are a lot of possibilities for using it more widely. And considering Mark gave us the issues that they are going to update it, we will make sure that we get to you a lot of other comments from other industries.
Okay, that's
fantastic. Well, so we've just to move on to a kind of medical question, and I'm going to bounce this one over to you, Frederick, which is, it's come in a couple of different forms, but it's to do with identification and contact tracing. Could you speak to that for a little bit, please?
Certainly. I'd just like to start by saying that confidence, trust, and the feeling of safety among our employees is vital. It's 100% vital to managing this. There are a lot of countries that have introduced very strict public screening or tracking even by cell phone, temperature testing, things like that. We prefer to have faith in our employees that when they are sick, they will actually tell us. So we need to have collaboration. We need to have the confidence of our employees. And that's also the principle we use for identifying cases, identifying close contacts. When someone gets sick offshore right now on any of our installations, they are well instructed to go straight to your cabin, regardless. If you get a fever, if you feel a little bit cold, if you have a runny nose, you go to your cabin. And we trust people to do this, and they are doing it. And then to identify, is this a high probability, a medium probability, or a low probability case? We have the nurse or medic interview the patient with the doctor on the phone often. And we look for classic symptoms of COVID. If they have one or more classic symptoms of COVID and the contact history or travel history, that makes it more probable, they are a high likelihood. If they don't have the contact history, but they have maybe one medium or one classic symptoms, they're the medium. And if they only have a runny nose, and we know there is a bit of uncertainty to this, but people get runny noses offshore as well. We can't test every single person with a runny nose, so then we just isolate them. So that's how we do it, and that's the same principle for contact tracing as well. We have a set of criteria that's it's similar across the world for the WHO, the CDC, the ECDC, the Norwegian National Institute of Public Health. They all define close contacts in roughly the same way. We've modified it a little bit for offshore, so that we include people on the same helicopter flights, things like that. But we do it through an interview. And then we identify them, we keep track of them, and we start monitoring them, talking to them.
So a very rigorous process. Thank you, Frederick. And I think we're going to head into the wrap now, as it's called in live casting terms. I'm just going to bounce a last question over to Rium. To do with you talked about alignment, and I suppose I'm interested in your operations and your R&D perspective. You've suddenly been plunged into this world of HSE and plunged into the biggest crisis the world has known for a very, very long time. And I just wondered if you have any sense of how this might change when you go back into an operations role or into an R&D role. How do you think this experience is going to change your perspective on how we better integrate HSE practices into how we're running our companies?
I think, well, in the US anyway, we're hearing a lot of people talking about PPE, and I think for the safety nerds out there, they're like, wow, people actually know what PPE is now, for the wider audience. So this is definitely something that people are talking about all the time. In addition to just safety of that being more integrated into operations, I think even just the regional crisis communications teams working cross-function is something that hasn't been people haven't really leaned on it so much, right? You have a question, you go to HR, you have a question, you go to HSE. But having these teams that are collaborating together has been quite powerful. And definitely anybody who knows me knows I'm very kumbaya. And so seeing everybody kind of coming together and playing upon each other's strengths and knowing, this is your lane, this is your lane, but together we'll make that decision based on all those input. It's huge. And I really do see that coming out of this, seeing the success that comes out of all of us working together that way is going to continue in that momentum moving forward. Because through all of this, we what do they always say? Your friend is when you have a common enemy, right? The friend of your enemy of your enemy is your friend, right? So we all have the shared enemy with COVID-19. And when you all come together to face that same thing, you really build relationships and build rapport and respect among each other. And you fight with each other and for each other. So I think that it's going to definitely, hashtagging this together. Very good to hear.
Fantastic. Yeah, I think that's the huge takeaway is collaboration. And, we've shown that when the scale and the urgency of the challenges, we can rise to them. And there are plenty of other challenges the industry is facing. So maybe this will make us stronger to collaborate facing all the other challenges that we have. So thanks a million, everybody. Absolutely fantastic. I love this. Can I do the heart sign? Thank you, everyone, very much. And I think that we're going to be taken off camera, Muppet Show style, and the rest of the show is going to continue. So thank you very much, everybody, and be in touch soon.
Thank you.
Take care.
Bye now.
I'm Johana Dunlop, 2020 SPE President. I'm glad to be with you today, even though it is on tape. These are uncertain times, and I can completely identify with the range of emotions we're all feeling right now. But we will weather this crisis, just as we have others in the past. We are stronger than we realize, and by coming together, it makes us a true force. For office workers like me, COVID-19 has meant a whole new environment. For me, that environment's my dining room table, where I now engage my coworkers and SPE members through a computer screen. But at least by staying at home, I can ensure that myself and my family are following sanitary protocols and distancing guidelines. But I realized last week while watching a safety video that my employer Oxy shared, I was struck by the many ways our industry personnel are being affected by COVID-19, especially out in the field. Oil-filled equipment may be difficult or impossible to sanitize against the virus. Our field vehicles are typically shared vehicles, and field operations are often set up with a trailer with people working in cramped quarters, making it difficult or impossible to maintain proper social distance. But work continues. But now we have more challenges than just those in the subsurface. Maintenance work is being delayed. Yes, in part because of cost reductions, but also to avoid having more people on site, especially offshore platforms. And the full impact of those delays will only be known at some point in the future. Of course, our industry isn't dealing with just COVID-19, but also with the lowest oil prices in decades. But SPE has acted swiftly to support our members through this situation. And a big part of the strength of SPE is our community of members, which goes well beyond the networking that members are missing right now because we're postponing and canceling face-to-face events. Now, we've added a page to our website talking about the many resources that members have access to, including mentoring, free technical webinars, and ways that members can contribute to our own community. And for any members who've lost their jobs, we are bringing back the members in transition resources we developed for them during the last downturn to support them with things like dues waivers and other helpful materials they so need. And for any members who are watching, I encourage you to check out the resources on our website and continue to do so because we're adding to that list continually. I'm passionate about our industry, and I'm passionate about SPE and its members. And for those watching that aren't members, I encourage you to consider it. We hope like events like this, one can help to bring the industry together and demonstrate the value of being part of SPE. We hope that this broadcast and others like it in the future will bring value to your life and your career. And on a personal note, I would have not reached the higher rungs on the career ladder if it was not for SPE and my involvement with it. So please stay safe, stay positive, and stay strong. Thank you.
Hey guys, and welcome to the show, or welcome to the second half of the show. Thank y'all, everybody, for watching thus far. I think we've still got about 250 something people that are watching in real time here on LinkedIn. This is absolutely amazing. This is the first ever SPE live session, whether it's YouTube, Facebook, LinkedIn, Twitter and Periscope. This is the first time we've ever done this. So we're working through a couple of the technical difficulties, just like when I started the Vito or Locksmith show, we had a lot of issues there, but this is nothing new to the oil and gas industry. Not everything works on the first time you run it in whole. So we're happy to still have you guys out there watching. We've got a great second half of this show here for you, and we'll try to get through this as I don't want to say as quick as I can, but we want to be able to bring you as much value as we can. And I can see that my phone is lighting up, and I know that I've got a couple couple of other people that are still sending me messages. So I'm trying not to get distracted by that. So anyways, if you guys are still watching out there, please let us know where you are watching from. We want to be able to know how big of an audience have we got going out there. Also, let us know what you like. If you like the conversations that we're having or the questions that are being asked, be sure to give us feedback. It's important that, we're all engineers here, or at least to some degree, we're the Society of Petroleum Engineers. We're an engineer here. Let us know if the feedback loop is broken and you guys aren't getting anything back to us. We can't get any better. So we want to get better. We know that this is our first time and we're going to improve, but the best way that we can improve the quickest is being able to get your feedback, seeing where you guys are hitting the like button. So I'm going to make a big request out there for everybody that is still watching. Tag one of your coworkers, tag a friend, tag a classmate, tag somebody in the comment section and bring them over to the video. Or if you can still see the share button, go ahead, hit and share and get some more people involved in the conversation today. So the second half of this, we've got a panel discussion and we're going to bring in some very diverse group of individuals. Let's see. We still got, what are we up to? 228. So we want to beat 228 by the time we finish here. So the very first person I want to be able to bring on, he is the drilling manager for a small independent West Texas operator. He's probably one of the smartest individuals I know, Ryan Brogley. Ryan, thank you so much for joining the show today, sir.
What an intro, David. And yes, for everybody's knowledge, I did pay him to say that.
Thanks, Ryan. All right. Second, knowing that 46% of the entire SPE membership is students, today we have a very special guest. He is our new perspectives engineer at Gibson Reports, and he's also a freshman at the University of Texas at Austin. David Nichols, thank you so much for joining the show, sir.
Yeah, it's great to be here. Thanks for having me on.
Oh, I love the fact that you're wearing the work shirt that I gave you. That's even better. Next, I also want to be able to share. It was in the previous video from Shauna. Sorry. I want to share that SPE is completely aware that many of you are going through life-changing events. And in that, SPE has a portion of the organization called Members in Transition. Now, what that's set up to be able to do is waive your membership fees for joining SPE, give you discounted rates for being able to purchase online education materials, and to be able to help out with insurance. Having said that, it brings me to my next guest. Our next guest was recently laid off from their global marketing director position, but not to be held down, has already come out and started their own marketing firm and is one of the smartest people I know in the marketing world. Jennifer Cannon. Jennifer, thanks for being on the show today.
Hi, David. Thanks for having me. I'm excited to be here.
And she didn't pay me to say that, unlike Brian. Paid me tons of money to be able to do it.
I did.
And finally, we have the incredible duo that is teaching hydrocarbons how to do gymnastics. It's Jamie Elrod and Maciel Diaz with Flipping the Barrel. And is Maciel's not able to make it? Can we hear Jamie?
Oh, can y'all hear me now?
Oh, there we go. See, we're still working through technical difficulties. It's okay.
There we go. It's so great to be here. Thank you so much for the intro. Not sure where Macy's at. I think she's going to pop in at some point. We had some technical difficulties earlier, so.
Yeah, so earlier before we started the entire live show, Maciel and Jamie went live on Flipping the Barrel and did a quick introduction to what we were doing today. It was a great little bit. I know there were some technical difficulties in there. I think it's just the simple fact that everybody's online right now watching Tiger King or whatnot. So that's really kind of draining the internet for everybody. But once again, like I said, guys, we really want you, please let us know where you're watching from. We've got Eduardo from Mexico, Erica, I'm trying to see, Lambert from Ghana. I mean, this is amazing. We're reaching a worldwide audience. Thank you guys so much for being out there. Ask us some questions. We're going to go ahead and get started here in a second. We'll give a little bit more time to Maciel. I mean, here's the thing, people. Like, some of us still have our jobs. Some of us still have to walk away. So if a phone call comes up, these people are going to have to take it. So we'll try to fire off as many of these questions as we can. So first, I actually want to be able to start with Mr. Nichols. David, you're going through something that none of us can ever claim that we went through, which is the simple fact that because of COVID-19, you are having to do all of your schoolwork online after having been not so much an online student, but living in the dorms at the University of Texas. How was this experience for you, playing out?
Well, it's definitely been an interesting experience, to say the least. It's definitely been a transition to move to all online classes. And I think the biggest issue I see to myself is it's hard to connect when you're online, because on campus, you have all these SPE meetings, AADE meetings, to where you get to meet industry professionals and get to, I guess, quote unquote, sell yourself to them and get to gain a bit of inside knowledge. And it's tough to do that online, almost impossible. We don't have any more SPE meetings, AADE meetings. So I guess the biggest hurdle for, students to jump through is to connect with industry professionals, because it's a bit tough, as I said, all online.
So with some of the other students that you have talked to, what's their kind of morale as far as maybe some of the guys that are, or ladies that are seniors that are getting close to graduating, or plan to graduate here in May? What's the kind of the morale and sense for them right now?
Well, students are definitely worried, as we see oil prices are down, job cuts, layoffs. Students, not just seniors, students across the board, they're worried about finding and keeping their internships. I see a lot of students trying to switch majors to mechanical engineering and whatnot. And many view this profession, this degree plan, as a gamble. They see it as if the industry comes back, then great, that's the ideal situation. But if not, they view that they're out of luck. And my philosophy on it is that you can use the petroleum engineering skills in many other sectors. Of course, all engineers, they go through these general engineering courses. You got the physics, the math, all that. And these skills can be applied to many different fields. You got Python classes, you got MATLAB classes, and as I said, you have all the foundations of engineering. So personally, I can see it as, if the industry recovers by the time they graduate, then great, that's the ideal situation. But if not, you can absolutely apply the skills you've learned into other industries. And if the industry, when it does come back to what we've seen it before, you can, of course, join back into the oil and gas industry, because there's always a need for petroleum engineers. Oil and gas is I believe, the fuel that powers our world, and it is. And so when the industry does come back, I can definitely see the people who have switched to other industries come back into the oil and gas industry, because there's always a need for petroleum engineers and engineers of all sorts in the oil and gas industry.
Well, David, thank you so much. David, I don't know if I was on. David, thank you so much there. I think I was going to ask Ryan the next question, but obviously I think he had a little bit of an internet issue. So next, Jennifer, I want to be able to ask you, as a marketing expert, what's the best thing for companies to be able to position themselves right now as far as COVID-19? I know I've seen a lot of, I guess, quote unquote, spam emails coming out about how, Dropbox or something is doing something in regards to COVID-19. What's the best response, and what's getting the best engagement for companies out there as far as addressing this issue, and then still addressing the fact that they are a company and they have services or products to be able to provide?
Yeah, so there was definitely a lot of COVID-19 posts, kind of those generic, hey, we're washing our hands, we're all in this together. What I think you can find value in this time is really talking about listening to your customers. So obviously rig count's down. What are the customers doing? Are they plugging wells? Are they doing completions? Where can you add value to your customers where they might not think of you as the go-to? So kind of sharing that information, like, did you know that we provide these services? Just to kind of remind them that you're there, you are operational, and that you can help them through this challenging time.
All right, is Ryan still going? Oh man, I'm dying to ask him. Oh wait, is Ryan there? Ryan, if you're there, so I've got a question for you. So the gentleman from Equinor, I cannot remember his name right now, so shame on me. talked about, having, some incidents out at the rig site as far as health issues. What are some of the things that you guys have put in place, or what are some of the considerations that you guys have got as far as your field operations? I think you're on mute. Ah, no. No, can't hear you, boss. Try one more time. I think we heard something. Nope. All right, how about I'm going to switch over to Maciel and Jamie. As far as y'all's perspectives, you are both in a sales position. How are y'all approaching doing sales in the current environment, and what's successful for the two of you? No, can't hear you, boss. Oh.
Can you hear us?
I can.
Okay, perfect. Well, it's definitely difficult, mainly because we understand where our customers are. They're not in a good place. It's not like everybody's right now trying to sell. And for myself, I'm just trying to give enough space to my customer to, like you said, let them know that we are here and that if they need anything, they can reach out. But I'm not trying to sell or push any products down their throat because I know what position they're in. So.
Second, what Macy's saying. So basically what I've been trying to do is just make sure that they know that we're here. We're supporting them. I've done a lot of calls, a lot of, Microsoft team meetings, a lot of involvement also in the field too. There's some issues with that though, because with COVID-19, they're only allowing so many people to go to the field and support. So we've just been very cognizant of what's been going on, and then just trying to make sure that we're going to be here through this. Even though I know it's a hard time right now, we're all to work through this at the house and move our in-person meetings to phone meetings, and that's just kind of the route that we've been taking.
Excellent. Now, Jamie, I want to you, Maciel, and Jennifer want to be able to kind of question the three of you. So recently, Maciel, you put out a story about having to go through the layoff process. Yesterday, Jamie, you talked about essentially, I wouldn't say being in the office, but being in kind of the hot zone as far as some of the layoffs that were made with your company and stuff. And then Jennifer, obviously you recently were laid off but have come back and started your own company. Can each one of you kind of give your feedback on that process, and maybe any advice for any of those that are out there watching on things to do, things not to do, just general advice that you would give to those that are out there watching?
So I guess I could start. Like I posted, I got laid off in 2016 with my first oil and gas downturn. And that's why I could relate with a lot of what people are going through right now. Is for me in that moment in time, it felt like the end of the world. It felt like I had just lost my career, my identity, who I saw myself as, right? I saw myself as being the field engineer and with this company, and that's all I had made up all these dreams and excitement of being with them for 5, 10, 15 retirement with them, and then all of a sudden you're in a change of plan. So what I was trying to tell people, and if they're relating to my story right now because they've gotten laid off, is dwell on it for a few days. It's okay to be sad. I was sad. I cried for days, for like about a week, but then you got to step out of it and realize, okay, this is my chance. I have a whiteboard now and I could do literally whatever you want to. So for me, it felt like a new beginning in a way where it was like, you know what? I've always wanted to be an entrepreneur. Maybe now is the time, right? A lot of people come out of really great successes through a downturn, through a struggle. A lot of really great companies will be created out of this pandemic because people are going to see themselves without a job. And it's kind of like you have this little fire under you where you're like, okay, it's a sink or swim. I need to pivot. I need to find something else to do, and then maybe start a business or whatever. The main thing is you just got to stay positive. Even though it feels like it is the end of the world, you just got to look at that positive side and say, okay, what could I learn right now? What is something that I've always wanted to do, but I couldn't because I was always stuck working, So like expand on your hobbies and see if you can find a meaning in your life that maybe was always there, but it was hidden because you were so busy working. So sometimes people realize that they really enjoy cooking and they were really good, and now they want to start a YouTube channel, and then they become really famous out of it, or things like that. So I think it's more of, it's okay to be sad, It's a really difficult feeling to feel being let go by a company, but there's a time for that, and then there's a time of being refreshed and saying, okay, what's next for me, and moving on from that.
Yeah, I'll go next, Mazio, because that kind of echoes what you were saying. So I think I actually commented on your post. I was devastated to learn that I was being let go. It kind of came as a total shock to me. And I had those few days where I really was down and I cried a lot. But off the back of that, I kind of started to think, I have 10 plus years with oil field service companies. This is my first layoff, so I consider myself sort of lucky, but I didn't want to take my knowledge somewhere else. I know a lot about the drilling industry, I know a lot about product commercialization and launches, and I was mourning that I might have to leave the industry. And that's kind of where the idea to start consulting came from. It was really, why don't I take my knowledge? There's so many oil field service companies that are small and either never had marketing, or unfortunately marketing is sort of that first group that's looked at as overhead, and how are they providing value, and we can just rehire professionals later. I even had to cut some of my team before I left. How can I help oil field service companies in this time? Budgets are down. They're cutting people left and right. So maybe a consulting business where I can offer my marketing expertise to these oil field service companies to provide value in this time kind of was something that I recognized, and hopefully getting word out, and I'm here to help.
Yeah, no, that's great, Jennifer. And I think that's a really great idea, and a really good way to use your skills that you've learned while being, in the industry, and as long as you have been in the industry, to offer those skills to more people than just, the one employer that you were working for. What I will say, in my experience, I was also about 2 years after I graduated, and experience with it was, I actually, in my whole life, I've always been somebody who, I could never quit anything. Time when I was working for this company, I felt that I wasn't a great fit, but with my pride and my I felt like I'm never going to quit it. Well, when the time came and they were having layoffs due to reduce the force and letting go of a whole entire terminal that they had, it came to the point where I knew that I was going to be one of the ones let go, just due to the circumstances. It's getting over that, oh my God, why me? And it took a while for me to go through that when I was still working at that company, because I knew it was going to happen. I just wasn't sure when. And I feel like a lot of people right now might be in that position where they're working for a company and they see that all kinds around them are leaving, and you start to feel like maybe you're next. My advice there is that even if you might be next, it does nothing to do with your worth ethic and who you are today, because you are not your career. And what I learned was, when they did let me go, I actually was working towards that point to a different role. And that's when I was hired by Schlumberger, which is something that I never thought in a million years would ever come to me. And I wouldn't have quit the job that I was at. So I would have never had that opportunity if I actually wasn't let go. So what I've experienced is that in the times when you are in these circumstances, you might find yourself in a better position to begin with at the end. And you might even find yourself maybe on a different career path that you might not have had the chance if you were still at that current company. Going through that at that time, and then going through it now, as we all are, as we see it's all very out in the open, how many layoffs are going on and how many furloughs are going on. And my husband and I are both in oil and gas, so there's always when both families are working in the industry. He's on the drilling side and I'm on the completion side, and we do see people around us that we work very closely with being let go. And the best thing that I can say is to just reach out and make sure to be a reference for those people, because the ones that are let go, that everybody holds a lot of value, and they just put a lot of work into their job. So when that happens, it hurts. But at the same time, you need to make sure that you just always have your resume up to date, always be networking, use this platform, use SPE. One thing I'd like to say about SPE is, when I got into the industry, I was part of a group here in Houston, and that's how I met a lot of people. I didn't know anybody when I came from midstream to working for Schlumberger. I knew no one. I evolved myself, and I needed people, and that's basically my name out, and was able to make connections. So use the platforms that are given to you as well, to network and to find your new opportunity. That's just some of my advice on that.
Yeah, I'd love to be able to say to anybody out there that is watching, I've been laid off 3 times, I've been fired twice, and then end up starting my own company and being, I guess, quote unquote, successful with it. So it's never too late. You can always keep moving forward. I do think a great point there, like Jamie had said, as far as keeping your resume up to date, but be sure that your resume is not the only thing that represents you. Like if you were a business, you wouldn't have just one little 3-fold pamphlet handout to be able to, market and let people know about your business. You would also have multiple other things. So be sure to, get involved in the online communities, whether it's on LinkedIn, YouTube, Facebook, Reddit, any one of those channels. Be sure, get involved, be sure to put yourself out there and, just start asking questions. You don't have to be an expert. You can just ask questions. And that's really what I did in the beginning for myself, and I still do it to this day. If you see a lot of the stuff that I put out there online, a lot of it is just me asking questions and trying to get my community and the industry engaged in conversation. So I'll try to see if Ryan's still good to go. We definitely want to get him in here. Can we hear you, Ryan? No, I still can't hear you. I feel so bad. Drug him into this thing. I think he's going to just put the headphones down. And are you calling it a day yet? No. All right. Well, how about this? We'll ask one more question over to Mr. Nichols. Going forward, what do you think is the thing that people should be looking for or as far as hiring managers and stuff, be looking at as far as the students that are possibly going to be coming out of university here over the next couple of years? What's the strength that, is added to your plate because you guys are going through this?
Well, I think the strength is just being resilient in a dark time in obviously the whole world, but also the oil and gas industry. I think what is going to stand out the most is just being able to stick this out, ride it through, and also, the basics, be a personal person, have a character, have a personality, be able to work with.
Excellent. Well, thank you, David. We're going to shoot it back over and see if Ryan has he got, can we hear him? No. Ryan, thanks so much for joining, man. We do appreciate it. Look, hey, for anybody that's out there that's watching, we still got, I think we're at like 200. Please tag somebody else. Let them know what we're doing. We want to be able to gauge, even after we get done here with the panels, we're going to have a little bit of a Q&A afterwards because we want to directly interact with the audience. So if you guys have any questions, I see Laura Stadler on there, Andre Wilcox, Alan Hittman, thank you guys so much for watching and commenting. We really do appreciate it. If you guys have got anything to say, let us know. We want to, that was the whole point of being able to do this live, is so that we can interact directly with the audience. Otherwise, we would have just filmed some stuff and then put it out there and hope that somebody watch it. We really want to be interactive. We want to see you guys hitting the little like buttons and stuff. So if you guys have got anything, let us know. So we've got Mr. Patel. I think he's got a question. How summer internships will affect for petroleum engineering going to their final year? Do you answer this? So we kind of answered this a little bit. I would say this, and I went and spoke with the AADE group at University of Texas not too long ago. The big thing is you need to be able to open up the scope of what you're looking at for internships. There are roughly 1,500 oil and gas operators in the state of Texas, and they're 10 times at the number of service companies. And don't look at just the oil and gas operators. If you've got a drilling background, if you're interested in drilling things, there's also the geothermal realm, which is almost a 1-to-1 as far as comparison there. So don't just look at, it's got to be Exxon, Chevron, BP, Shell. As far as your internship capabilities, there's tons of small independent operators or mid-sized companies, as well as independent oilfield service companies that could use your talents and would love to be able to have you come in and just ask why. because that's the best thing an intern can do, is come in and challenge the status quo of what any company is doing and saying, why are you doing it like this? Because if they can't explain it, then that probably means that they need to change that procedure and move into the 21st century. All right, so we're getting any questions. Also, I should say, anybody that's out there watching, go and connect with any one of our panelists. Connect with David, connect with Ryan, Jamie Messiel, and Jennifer Cannon on LinkedIn, or follow them on Instagram, Flipping the Barrel, and any one of the I wouldn't say connect on Facebook, but just on LinkedIn, connect with all of us here. So we're still looking for anybody that is watching. Let us know where you're watching from. So then I'll ask a final question to everybody. Give me your final review as far as, what do you think are the silver linings going forward? What can we learn the most coming out of this situation? And we'll start with you, Messiel. Is there? Oh, nope. I think your audio's off. All right. We'll switch over to Jennifer while Messiel's getting her audio. Jennifer, what do you see as some of the silver linings coming out of this?
I mean, for me, it's really, I think one of the best things about this industry is the network of people. I posted right when I laid off. I think it was kind of a shock, but I was amazed at the amount of support I got from the industry and just the people that have reached out in the messages. So lean on your network. I know that it's scary. Everyone's kind of going through a hard time and there's a lot of uncertainty, but the greatest strength of this industry is the people and the connections that you make.
Excellent. Messiel, are you ready?
Yes.
All right. So your silver lining.
I think for once is to realize the impact that social media has in a time like this where we can't leave our house. Everyone's turning to social media and it's time to build your brand. I've been saying it for years and years, and the future is your brand, not just who you work for or what you do for a living, but it's how people know you on social media. And I know a lot of people that weren't interested in going into it. Now they're probably thinking, hey, now is my chance, because we're all stuck at home. So I think for us, it's realizing that social media is honestly the future, and it's a really good way to connect with the entire world out of your phone, a screen, or a laptop. So I think for me, it's just appreciate social media, because there is actually a lot of positive from it.
Excellent, Messiel. Thank you so much. All right, Jamie, over to you.
So I would say what the silver lining out of all of this is the connections, the deeper connections that you make with not just your customers, but your friends, and kind of how much you appreciate all the little things that you had that you didn't realize how great they were until they were taken. For instance, the other day, Jason and I just wanted to go out to eat, and we couldn't, right? So we go to Chick-fil-A, and then what we did is we just sat in the parking lot of the Marshalls that's right across, which is completely empty, and just ate in there, ate in the truck, because it was like just anything to just get out of the house. So I think coming out of this, we're going to appreciate our families, our relationships, and then just our connections a lot more. And then also industry-wide, it's going to be a smaller industry just by, the massive amount of people that have been let go in this industry. It's going to be smaller. It's going to be even closer knit than what it was before. So I think just appreciating that, and then just appreciating too, the time that you are able to spend with your family now. I think you're going to be some things that.
Excellent. Thank you so much, Jamie. I'll see if we give Ryan one more shot. Ryan, can you say anything? So what Ryan said was the biggest thing he learned out of this was that technical difficulties not only happen at the rig, but they also happen at the house. And you won't always be held accountable for your technical difficulties, but it's how you respond to them and come back from them. So we will do another one of these episodes in the future with Ryan, and you'll be able to hear him just yammer on for hours. Is that right, Ryan? Yeah, there we go. All right. Finally, for you, Mr. Nichols, what's the silver lining coming out of this for you, please, sir?
Well, I want to piggyback off of Jennifer and Messiel. Building your brand and relying on connections is absolutely valuable. Your connections are priceless. And actually, the first thing that they teach you at school is build your connections and build your brand. Be someone that the companies want to hire. And so, again, piggybacking off of them, absolutely building your brand and relying on your connections, I think, is the silver lining, the most valuable thing you can do at this point in time.
Excellent. Well, thank you each one of the panelists for joining us. Thank you to everybody for still watching. I appreciate having all you guys on. We're gonna go ahead and say bye to you guys, and then we're gonna try to do a quick little interaction here with the audience. So if you guys are still watching, I see that we've had James Hahn, Tapas, Dipson, and Randy Patterson. All of you guys out there watching, there's about a 30-second delay, so I'll try to go along here. But if y'all have some feedback from today's show, please let us know. We want to be able to get better. What are the things we did right? What are the things we did wrong? What are the things we can do better? What are some of the content you would like to be able to see in the future? We've got really an open platform here. We know that normally you're used to attending SPE events and seeing papers provided in person. We're looking to be able to do just about anything online, and we want to be able to provide the most value that we can to you, the audience, and SPE members, and be able to help other people who are outside of SPE membership be able to come in and be able to see the great things that we can offer for you. So like I said before, we've got members in transition where we waive the dues for being able to sign up, discounted educational materials, as well as help with your personal insurance and stuff. So be sure to go to the website and check those out. So we've got Mark Rubin, the CEO and executive director of SPE, is actually in the comments section right now. So if y'all have something you want to be able to say directly to him, if you want to link up with him on LinkedIn, he's in the comments section right now on LinkedIn. Go connect with him, as well as any one of the speakers and myself, if you guys would like. We'd love to be able to have that connection and grow the network as well. So we've got even Dr. Nils, who's part of the SPEs, the assistant director. He's over there as well. So we're getting a lot of technology topics, free of cost or fee cut. And that's from Patel. SPE online happy hour from Ian. I think these are all things that we can do. I don't know if we can provide the drinks via online. We can just do this. Less operations, less discoveries means, okay, so it's what we can do to help our connections. Networking is about serving your network. Well, Mark, we would love to be able to see what we can do what do you believe is that we can do to be able to help serve you even more? Give us some ideas. We'd love to be able to bounce them off. Myself, Maciel Diaz, Michael Gaines from NOV, and Jamie Elrod, we've all been part of a group along with SPE brainstorming over the past couple of weeks, things that we can do for our audience, for you guys out there via this platform that's going to provide the most value. So we know that we're not going to be able to come up with all of the ideas. Some of the ideas are going to come from you guys, and we would be more than happy to be able to implement those. It doesn't have to be just us. Randy McDonald out there watching, thank you so much, buddy. I do appreciate it. He's from here in the local Austin area with End Zone Guidance, one of the directional drilling companies. Again, Dr. Nils, he's very active in the comment section right now. What artificial intelligence can do. Oh, the comments are coming by so quick, I can't even read them all. I just, once again, thank everybody for watching. We really do appreciate it. We're going to turn it over to Michael Gaines, who's going to wrap up the show. I know this one went a little bit longer than we had anticipated, but we look forward to being able to serve you, the community, and being able to bring you the best value that we can on this platform. Thank you guys for watching. I really do appreciate it.
All right, well, that's going to do it for us for this first SPE International live broadcast. I want to thank you for being a part of today's conversation and joining in to all of the conversations that we had today. Also want to thank Johana and all of the panelists, as well as Shauna Noonan, the 2020 SPE president, David Gibson and guests, as well as Jamie Elrod and Maciel Diaz from the Flipping the Barrel podcast. We're all feeling the effects of this pandemic, coupled with the oil prices, but we're here to say that you're not alone. So let's stay strong as a community, continue to rally together, and support each other as we always have. If you have any stories that you'd like to share or encouragement, we ask that you use the hashtag #WeAreSPE. As a reminder, this video will remain on SPE's social channels where you're welcome to share it with your network. That's our broadcast for today. Thanks for your time, your energy, and until next time, this has been SPE Live.